All right, it looks like we are ready to get started. So hello everyone, and thank you so much for joining us. The Southeast Mental Health Technology Transfer Center is pleased to present today's webinar event, Race and Recovery in the Peer Support Workforce. My name is Emily Moore, and I will be moderating today's event. Before beginning, I would like to take a quick moment to describe the work of our center, followed by an introduction of today's speakers. The Southeast Mental Health Technology Transfer Center is located in Atlanta, Georgia at Emory University's Rollins School of Public Health. We are proud to serve the 8 states in HHS Region 4. Our expertise in public health programs, systems, research, and evaluation provides a unique lens through which we can address mental health priorities. The goal of the Southeast MHTTC is to accelerate the adoption of evidence-based mental health programs by providing training and technical assistance to Region 4. We use a public health approach to build leadership capacity and to provide mental health trainings and resources to providers, agencies, and communities across the Southeast. We encourage you to visit the Southeast MHTTC website to learn more about our center and upcoming events and opportunities. I'd like to take a moment to introduce our speakers for the day. Rosalind D. Hayes has been an employee of the Georgia Mental Health Consumer Network since 2010. Her current position is that of statewide coordinator of the Peer Support, Wellness, and Respite Centers. She supports the Georgia Mental Health Consumer Network as a trainer, facilitator, including certified peer specialist, peer zone, and intentional peer support. Chris Johnson is the Director of Communications for the Georgia Mental Health Consumer Network, where he is responsible for disseminating information about recovery and wellness opportunities to behavioral health peers and providers across the state. Since joining the Georgia Mental Health Consumer Network, Chris has overseen the expansion of the outreach and impact of the center or agency at the local, state, and national level. I'm now going to stop screen sharing and turn it over to Sherry Jenkins Tucker, the Director of the Georgia Mental Health Consumer Network, to say a brief hello and welcome all of you here.
Good afternoon, everyone. Thank you so much for joining us. As Emily said, I'm Sherry Jenkins Tucker. I'm the Executive Director of the Georgia Mental Health Consumer Network, a certified peer specialist, family member, and a person in long-term recovery. We're so delighted to have the opportunity to work with the Southeast Mental Health Technology Transfer Center and to be with you all this afternoon to talk about race and recovery in the peer support workforce. Welcome and thank you. Roz and Chris, take it away.
Right. Thank you, Sherry. And thank you to the Southeast Mental Health Technology Transfer Center for the opportunity to do this work. My name is Rosalind Hayes, and I am a person in long-term recovery. What that means for me is that it's been a little over 12 years since my mental health concerns or addictive disease challenges have prevented me from living a life filled with meaning and purpose. Today, I'm a daughter that my mother is proud of. I'm a trustworthy friend and confidant. I'm a valued employee of the Georgia Mental Health Consumer Network. I am a respected contributor to my community. I am a homeowner, and I exercise my right to vote. And I speak out loud about recovery because everyone needs to know that recovery is real and available to us all. I speak out because today, as a result of recovery, I have a voice. And with that voice, I have an obligation to use it to challenge social injustice, discrimination, and racism. I am committed today to being a part of the change that I want to see in my community and in this country. Chris?
Thanks, Roz. I am Chris Johnson. I am a person in long-term recovery. Can you all hear me? Roz, can you not? Okay, great, thank you. I am a person in long-term recovery. What that means for me is it's been a little over 11 years since my mental health or substance use concerns have prevented me from leading a full, productive, and rewarding life. As you heard, I'm the Director of Communications for the Georgia Mental Health Consumer Network, which means that I get to do great work with peers and colleagues around the state and around the Southeast. And we're just really happy to be with you today to share some of what we learned at our listening session and to talk about path forward. Just So you know what we're trying to do today. By the end of this training, you should be able to describe how race impacts recovery supports in the community and the behavioral health system, discuss how race creates barriers to recovery and wellness, and identify some immediate actions peer support providers can take to recognize and remedy barriers. But before we review the data collected during the listening session, I'd like to give you just a little background on how we came to collect the data in the first place. Roz and I first met in December of 2015 when we participated in a cultural competency train the trainer training when I was working at another organization. So we've been doing this work together for a minute. We've had lots of challenging conversations over the past few years. But really, it's been more of an ongoing dialogue rekindled at different times by different events within and outside the Georgia Mental Health Consumer Network, where I joined Roz in November of 2017. Some of those discussions have been about inclusion, representation, and identity, sometimes within the context of behavioral health, but more frequently within our community and society. Roz and I know each other and we trust each other enough to have these challenging conversations. We also know that behavioral health does not exist in a pristine vacuum. Community-based behavioral health supports and services are inevitably, to some degree, going to reflect the values, beliefs, attitudes, and behaviors of the communities where they are provided, and sometimes despite of and sometimes thanks to the best efforts and intentions of service providers. So in the spring of this year, the killing of Ahmaud Arbery in Brunswick, Georgia was really a call to action for us. We are not just trainers. The Georgia Mental Health Consumer Network provides direct support to hundreds of peers across the state each month, and we were hearing directly about increased anxiety, fear, depression, anger, and a long list of emotional responses people were having to the images they were seeing and the words they were hearing every day about the state where we live. We knew that shaking our heads and wringing our hands was just not going to be sufficient this time. And as much as we may have personally grown in and really honored the work of developing cultural competency and cultural humility, that clearly isn't enough. That work addresses the world inside the behavioral health bubble, and that isn't where any of us live or drive or go to school or shop or go out to eat. We wanted to address the issue of racism in behavioral health, call it by its name, and lay the groundwork for a path forward. Because of the timing of the pandemic and the lockdown and the protests, identifying the right opportunity and the right time for it, felt like a challenge, just beyond the inherent complexity of addressing the topic at all. After the killing of Rayshard Brooks in June, the Georgia Mental Health Consumer Network included a Black Lives Matter message in our monthly email to our members. And not only did over 100 people unsubscribe from our emails, we also received emails from people letting us know how unhappy they were with us for including our Black Lives Matter message in our email. And these are people who at some point in their lives were interested enough in supporting mental health in Georgia that they subscribed to our email. We don't think it's that difficult to see how racism is a barrier to behavioral health. For anyone who hasn't seen Maslow's, or for anyone who has seen Maslow's hierarchy of needs, which I've conveniently put on the screen for you if you have not seen it, we know that safety and security are down near the bottom of that pyramid, just above food and water and air. And if we don't feel safe, we are unlikely to be able to fully realize those other things that are fundamental to recovery and wellness, like connection to other people, confidence, and respect. And if people do not believe the behavioral health public safety net was designed to hold and support them safely, will they use it? And more importantly, if we think about the hierarchy of needs, can they truly benefit fully from participating in that system? These are questions we cannot answer today, for sure, but when we put forward to the Southeast Mental Health Technology Transfer Center that we would like to begin asking questions about racism as a barrier to recovery and wellness, they were very supportive in allowing us to do this work, and we're very grateful for them for the opportunity. We do realize the limitations of the data we're presenting. The people who participated in the listening session self-directed. The listening session was held during the week, workday, during the week. Some people may not have felt supported by their employers, and there are plenty of well-intentioned people who would just rather not talk about this. But as a snapshot of a moment in time of how this group of people from across the Southeast have experienced racism, we feel their responses are illuminating, challenging, and motivating, frankly. And now to really get us started, Roz is going to review the data from the first poll question from the beginning of the listening session that was held on September 15th. Roz?
Thanks, Chris. And you know, before we dive into this, I just want to thank everyone who showed up to participate in the listening session. It says that you want to be, you know, you want to be a part of change. These conversations aren't easy to have, and so, you know, people showed up with their authenticity, and we got some really interesting and intriguing information. Looking at this the first question that we asked is, how much do you believe racism impacts the ability of peers to receive the support they need? And as Chris just said a moment ago, we don't think it's that difficult to see racism as a barrier to behavioral health services. And as you can see, based on the responses to the question, we were right. You know, people agreed that race is a barrier, at least to some degree, with 0 participants responding, you know, that is not a barrier at all. You can see nobody said that race wasn't a barrier. And while 11% believe that racism impacts peers' ability to receive the services a little, the vast majority, or 89% of people, believe that racism impacts the peers' ability to receive the support they need, either somewhat, which came in at 23%, or 66% who said that it impacts a great deal. So just recognizing the historic, systemic, and institutional nature of racism in this country, our data is pretty much in line with national Gallup polling, where more than 65% of the public say that racial and ethnic discrimination is a big problem in the United States. So Chris, I'll give it back to you for the next question.
All right, thanks, Roz. Okay, our next question was, on a scale from 1 to 7, how present is racism in the behavioral health treatment delivery system? As you can see, about 75% of participants felt that racism is more present than not in the behavioral health treatment delivery system. 35% reported that it is entirely present. We were intentional in not defining what present means. This is a very broad poll where we are essentially taking the temperature of racism in the behavioral health system, right? On this question and the next, which Raj is going to go over with you, you know, we wanted people's own understanding of what racism is and what its presence looks and feels like to guide their responses. It is important to note that no one reported a total or near total lack of racism in the behavioral health treatment delivery system. Throughout the listening session, we did hear divergent views about the pervasiveness and impact of racism. You know, there was not a uniform response, especially in the breakout groups. You know, we heard lots of different thoughts and ideas and opinions, but there was some consistency here, and on the slide Roz just went over with you, you know, because no one who participated believes that racism is not present at all. All right, Roz?
All right. And so we asked the same question on a scale from 1 to 7, how present is racism in community supports? And so we're looking at community supports outside of the behavioral health treatment delivery system. So this might include anything from 12-step meetings, mutual support groups, to housing, or any of those things that we look to the community for to support our recovery. And when asked that question, it won't be surprising to you that, you know, the answers look very much like the data that Chris just shared. As far as racism within the behavioral health treatment delivery system. So 77% of those responding said that racism, you know, was outside of the system. And 33% of those folks felt like racism was entirely present. And so again, these results really mirror the results that Chris just shared. And again, with this question, just like the last, no one felt that racism was not present at all. And I think that I mean, you know, in this day and age and with everything that's going on, for me, I take heart in, you know, at least acknowledging that race is an issue at some level. You can see, you know, somebody came, you know, a few people, 5% of the people came in, you know, around a 3 saying, yeah, but still no one said that it wasn't present. And so I think that, you know, says a lot about where we are with what's going on in this country and what's going on in our behavioral health system. Chris?
Thanks, Roz. The next question is, how many times have you witnessed overt or implied racism within the behavioral health system? And this is one of the questions that I would have liked the opportunity to follow up on. In response to the earlier question about the presence of racism, no one indicated that there wasn't any racism present, but here 5% of participants say they have never personally witnessed any. There are a number of obvious seeming explanations for this, including peers or colleagues who report experiences to them, like how long they've been doing this work, etc. But this is a disconnect that I would be interested in like learning more about and digging deeper into. Similarly, the people who have witnessed racism more times than they can count, I would really like to learn more about. Like, was there a single person or small group of people engaging in behavior repeatedly or over time? Have they been working in the behavioral health system for decades? Like, I just want to know more about, you know, sort of the concentration in time of those experiences. I'd also like to find out if these experiences were primarily as a provider or recipient of behavioral health supports and services. Most of the people, the vast majority of the people responding to these questions are people providing peer support. And for most of those people, at least those that I know personally, I won't speak for folks I haven't met, we've received supports and services ourselves at some point. But again, we specifically left it open. We weren't trying to identify employers or systems. We were trying to understand people's experience and understanding of, you know, the system and systems as a whole in the Southeast. And, you know, also personally, as someone who had a couple of previous careers over a number of years, one in finance and one in higher education, I definitely witnessed overt and implied racism many times, but I don't know that I would have indicated, you know, the more times than I can count in a poll like this before I started work in behavioral health back in 2014. And personally, I would just really love to dig deeper into this data again to understand if, you know, my experience is unique or symptomatic of this work or of this work in this region. All right, Roz, I'm going to pass it back to you.
Thank you, Chris. And so this next question, do people of color feel equally welcomed in your behavioral health system? You talk about a question that I would really like to dig deeper into. You can see most people, or 37.5% of the people, felt like people of color feel somewhat equally welcomed, while 35% that would said not at all, said little or not at all. And 27.5% of the people said that people of color feel absolutely welcomed. I definitely would love to take a deeper dive into this question. I'm curious to know how people arrived at their responses, you know, and I know that all of this is just based on, you know, my lived experience or our collective lived experience. And my question comes up is like, you know, how can you know if people of color feel equally welcomed in your system if you don't ask them, you know? I mean, for example, you might be a part of an organization that's intentional about diversity in hiring and that recognizes and values cultural differences or not. You know, I know that based on conversations with some of my colleagues of color, you know, that perspectives on racism within our organization vary widely. I would say that people of color feel welcome. And you notice I didn't say equally welcome because, again, that's such a subjective thing. But I would say that people of color feel welcome within our organizations. And you know, I've had conversations with colleagues that say they don't necessarily agree, or at least not to the degree that I believe it to be true based on my experience, you know. And so this question, it really takes us into considering worldview and perspective, you know, and recognizing that these personal points of view or worldview, or that they're shaped by our life experiences, our values, you know, our current state of mind, and the assumptions that we bring into situations. You know, there's a whole lot that goes into this. And so, you know, I think that it just is a very interesting question. And again, I would really like to know how, you know, 27.5% of folks could say that people of color feel absolutely welcome. You know, I hope that that's true. And I think that that's great. And even the somewhat and absolutely put together. But I would really, you know, like to dig deeper, challenge that, see, you know, because lots of times, you know, we when it comes to these questions of race, we want to try to kind of paint the pretty picture in the sky. Well, you know, not in my organization, not, you know, amongst the people that I know. But until we're able to really have deeper conversations and ask people if they feel welcome. And if they say they don't feel welcome, ask them what would make them feel welcome, you know. So it's a very interesting question with some interesting results. And so, Chris, I give it back to you, sir.
Thanks, Roz. The next question is, as a certified peer specialist, how empowered do you feel in your workplace to address racism? Again, with this question, we did not define empowered. We left it up to participants to define for themselves what that means. For me personally, that means, have I received training in how to address racism? Is there a clear reporting process in place? Am I confident that if I report something, it will be thoughtfully considered by a group of people who can understand the context of what I am reporting and why? You know, for someone else, it might just mean, am I confident enough to deal with this very potentially awkward thing that might also affect my career trajectory, right? So I was personally kind of pleased and surprised that more than half of people at least feel at least somewhat empowered. It wasn't as surprising that the largest group said their level of empowerment depends on the circumstances, because really the circumstances change every time. Even if it is the same person or group of people engaging in the same behavior a second or third time, the second or third time changes the circumstance from it being possibly anomalous behavior to it being a pattern of behavior, and that just feels different. You know, again, I would love to follow up with this data and be able to ask people, why do you feel this way, right? How are you empowered? What can make you feel more empowered? This feels like a really rich opportunity for further exploration, and those of you who are on the listening session with us, you know that we're going to be doing a series of topical discussion webinars through the beginning of next year, and I'm hoping we're going to be able to include this as part of those discussions. And now Roz is going to walk us through our final pie chart. Roz,
Right.
Let's have that last piece of pie.
All right. So this, another very interesting and not surprising, not so surprising data that came out of this question. How has your organization responded to recent social unrest surrounding social justice? We see the first response, my organization has done nothing. And that, you know, took a good piece of the pie at 20%. It goes on to say that 16% of the people say that their organization has provided internal, external communication. So we've acknowledged that this is happening. C at 18%. My organization is in the process of gathering information, providing communication, but has not made meaningful changes, you know. D, which was the biggest chunk of the pie at 32%, said that the organization is in the process of gathering information / making meaningful change. And then the numbers drop off significantly on the positive end, where my organization has thoughtfully responded and made meaningful changes at 9%. And my organization has thoughtfully responded, made impactful changes, and is in the process of continuing to gather information so that, you know, and that's just 5%. This 5% recognizes, you know, the necessity of action, of change, and of staying in the process. You know, this can't be, you know, that we do one thing and then that's it. We've taken care of it. You know, this is an ongoing conversation, an ongoing connection to try to really, you know, if we can hope for any really meaningful and impactful change and to sustain that change. And now for me, this is another one that I'd like to be able to follow up on. I would really like to hear from those folks who identified their organization with number D, with letter D, saying that the organization is in the process of gathering information and making meaningful change. I don't know about you guys, but, you know, just, you know, in my paying attention to the news and everything that's happening, you know, when things flare up, you know, George Floyd's death, his killing just really, you know, sparked so much protest and outcry. And it really, you know, folks who had been able to ignore or to kind of dismiss, you know, the killing of other people, somehow, you know, watching George Floyd's death really, you know, ignited people, and it really spoke to folks who would be allies against racism and would be, you know, take an anti-racism perspective. It really motivated folks to action and to say, I can no longer act like this isn't happening. And at the same time, we know when those fires get lit and people are really, you know, they're ready to process and they want to do something, sometimes conversation is as far as it gets. You know, we talk about it, we feel good about it, we have these conversations, but then the meaningful change part never really comes. And so I would be really interested to hear from that 32%. And when I look at this and I think about these responses, you know, I can't help but think about how they mirror, you know, what's going on in our larger society. You know, again, that my organization has done nothing, or my organization has paid some lip service to it, but not much more beyond that. And so it's something, you know, hopefully we'll be able to circle back around, you know, maybe 6 months from now, and really ask the question about, you know, what has changed. So thank you, Chris.
Good. Thanks, Roz. And I think we are now going to ask our friends at the Southeast Mental Health Technology Transfer Center to help us out with a poll, just because we are interested in finding out how those of you who are here with us today are feeling about what you've heard so far. So Emily? Okay, I can read the questions. Basically, and this is just the one question we're doing right now, and it is, how surprised were you at the presence of racism identified in the polls? Were you very surprised at how much was identified? Just surprised? Not surprised at all? Surprised at how little racism was identified, or very surprised at how little racism was identified? So we have a range of responses for you there, and this is just reflecting back on the data you just had presented to you by myself and Rosalind. If you've been reading other data on racism in the past half hour, please don't refer to it. Right. Emily, are people voting?
They are. We have a lot of people still voting.
Okay.
I still see a couple of answers coming in, so I'll give it a little bit more time. It looks like 57% of our participants have voted so far.
Okay. Sweet. And I know on some devices, the polling is less friendly than other devices, so.
Okay, Chris, it looks like voting is slowing down. Would you like to go ahead and end the polling and share the results?
Yeah, let's do it. Okay. And again, in this work, there's always a range. For those of you who are on your phones and may not be able to see some relatively small print, 8% say they were very surprised at how much was identified. 11% said they were surprised. 67% said not surprised. It was about what I expected. 10% said they were surprised, and 5% said they were very surprised at how little racism was identified. So I think these numbers kind of fall in line with the numbers from the listening session, right? Just at the identification of racism and behavioral health. Roz, do you have any thoughts on that?
I agree. They fall right in line with what was reported, and they fall in line with national polling, about racism. And so, yeah, we're right on track.
Okay. Awesome. Thank you, Emily. All right, and now we're going to go on to the notes from the breakout sessions. Over 150 responses to 4 questions were recorded. The responses presented here mostly represent common themes, though a couple of responses are included for their singular nature, and they're going to be identified as such. There were 4 to 6 participants in each of the breakout groups, and there was a staff member from the Georgia Mental Health Consumer Network writing down the responses. We really wanted to create a sense of intimacy and some anonymity that would allow for open and honest dialogue, and that would allow more people to share in a fairly constrained time frame. We learned a lot by asking these 4 simple questions, and Roz is going to kick us off with the first. Actually, I am going to kick us off with the first. Sorry about that. No, Roz, it is you.
Yes, it's me.
It's you.
And so the first question was, what racial barriers to recovery and wellness exist in your organization? And here, we just chose, again, like Chris said, some of the responses that, were part of a common theme. And then there's definitely one that's very singular in nature here. And so the very first response that's here says, organizations don't understand the daily struggle of being a person of color. And I just think that's a resounding theme. Organizations don't understand, communities don't understand, our society at large doesn't understand. And some of the sentiment is that, we should be over it, or we should be grateful. And so just, dealing with the things that come with being a person of color on a day-to-day basis are just generally misunderstood across the board. This next response says, this person was at they were at a meeting at a statewide nonprofit, and a Black person said she wanted to open a center, and she was told, that's very expensive, and oh, you read so well. And they knew nothing about her education or what kind of money she has, And so this speaks to some of that lack of understanding of the daily struggle of being a person of color. This is speaking directly to implicit bias, to microaggressions, and assumptions based on stereotypes. And, you know, the idea and the thing about it, you know, a person could look at this and say, well, you know, those are compliments, you know, that you read so well. But the underlying message in that is that, oh, I'm surprised that you're a Black person and you read well, because the expectation is not that Black people would be able to read well. Or with the money, you know, that expectation is that we couldn't possibly have the money to afford to open up a center, and so there's no reason to even have a conversation. You know, we'll just dismiss that. And there are those kind of dismissals, and again, those microaggressions, that people who, you know, live with mental health concerns deal with, and that people who are of color deal with. And so you got to put the biases that come with living with a mental health concern, and then put being Black on top of that, and it just adds another layer. Okay. The next one, I work in mental health, and this is one. Okay, I work in mental health and drug court, and one of the individuals that I served showed me a picture of himself dressed in the robes, KKK, and makes racist comments. My organization says that we have to meet people where they are, and I try to do this, but it's hard. I told him that I would have to disagree, that we would have to disagree on this issue. And I find that I do not want to help him as much as others because he's such a racist. This is one of those that Chris referred to as singular in nature. You know, this guy, you know, is having to figure out how to provide support to someone who doesn't have, you know, who has some really strong negative views about people who look like him. And the best that he got from his organization is that we have to meet him where he is. You know, we got to try to figure out, you know, how to do this. And I can't help but wonder, you know, that if this individual identified himself, for example, as a pedophile, would the response of the organization be the same? Well, we need to meet him where he's at. You know, I just don't know. But when you want to think about support and thinking about historic trauma and even, you know, trauma right now, and that the best, again, that the organization can say is that, oh, well, you have to provide peer support for him and meet him where he is. That kind of leaves us out there on our own, you know, and not feeling empowered and supported within the organization. The next one, the leadership team at my organization does not reflect the population of the staff. And this is interesting because it says that, you know, the staff looks one way, the help looks one way, but the management, you know, looks a different way. And that there is a disconnect, or it's disproportionate, you know, where, you know, the leadership, you know, I'd have to say leadership, you know, is probably majority white, and the population of the staff is people of color. And that, again, is just a reflection of our larger society and where the power lies, who actually can make decisions, and who gets to kind of be relegated to the ranks of the help or the staff. The next one, our agency has doctors that deal completely different with people of color than they do with Caucasians, and most of the time it's quite obvious. This is just a historic kind of institutional thing. If we want to talk about psychiatry and think about that, you know, and the history of that, you know, there was from the very beginning a division made between African Americans and Caucasians, you know, and African Americans were seen to be more animal-like, you know, and so, you know, required a different type of treatment. You know, the idea that somehow Black people don't feel pain at the same level as whites feel pain, and this was justification for experimental surgeries, you know, that happened to Black people. And so this is, you know, something that definitely has a historic context, and it's something that, you know, if you want to read more about it, there's plenty of literature about it. And Chris is actually going to speak to this a little more in his next slide. So thank you, Chris.
Thanks, Roz. Our next question is, what racial barriers to recovery and wellness exist in your community? The ones that we point out for discussion are racial barriers in housing. People find it very difficult to find decent housing, and the agency does not address this as it should. Fear of interfacing with police in the community. DFACS showed blatant racism. I have heard from Black peers that ministers and family members told them that they were not praying hard enough or else they would not have mental health issues. And there are not enough people of color in mutual support groups. Now, I know from my time providing peer support that there are opportunities for racism at every inflection point on someone's recovery and wellness journey. When you go to get your state identification card or your social security card, your EBT card, or even your library card, so you can use the library computers to look for a job or a place to live, you can encounter racial barriers that simply don't exist for other people. This will be a lot for most of us, including this guy, to handle on a good day. But I was seeing it happening when people were trying to forge a path forward from some of the most challenging moments in their lives. And again, not to dwell too much on that hierarchy of needs we showed before, but racial barriers to housing, food, and medical needs are barriers to recovery and wellness, right? It is of a whole, it's of a piece. You can't really separate them out. They probably need to be addressed differently, like, housing is different than this, but it's all connected. We heard from multiple participants about how stigma and attitudes toward mental health in some parts of the Black community, particularly in the faith communities, are barriers to recovery and wellness. This wasn't really a question we asked per se, but it came up a lot, so we included it here. And it may be tied to the lack of people of color in mutual support groups, including 12-step recovery groups that was also mentioned several times. I can feel confident when I'm traveling that whatever town I'm in, I can find a 12-step meeting and feel welcomed and comfortable there, right? People are going to greet me and shake my hand, when we can shake hands again, and welcome me and make me feel a part of. And that just isn't true for many of my Black and brown friends. And even during this pandemic, when most 12-step meetings are online, most of those Zoom calls reflect the lack of diversity of the physical spaces that they've replaced. We're told in the 12-step recovery community to look for the similarities, not the differences, conveniently placing the blame for discomfort on the discomforted. But we rarely hear about how those differences, and quite frankly, for many of those people, trauma related to some of those differences, really are barriers to recovery. I feel personally, that, it works if you work it, instead of asking, what do you need to make this work? There are different approaches for sure, different ideas for sure, but I think there's a lot of validity to, I think there's a lot of validity to all of it, but this slide particularly resonated with me. And the next question, what experiences of racism have you encountered in your behavioral health care system? This is a hard slide, so I will go through a hard couple slides. First slide, excuses are made not to provide services to many people of color. I have seen people of color given excuses as to why they were not seen in a timely manner or why they can't get answers to some of their questions. It's as though they don't exist, or how dare you question someone in authority. There were many experiences reported of Black and brown people being treated as less than during our breakout groups. This particular quote stuck out because it brings to mind how much data there is about people of color being treated differently when they do things like buy a car or rent an apartment. it can be easy to forget in public behavioral health that this is still a service that someone is paying for, whether it is the person receiving the service or taxpayers or insurance companies or some combination of those things. And while those of us who are service providers may think of ourselves as being held to a higher standard of providing equitable service in public behavioral health, the experiences some people are having, and that were reported here, really doesn't seem distinguishably better than what they receive anywhere in their community, right? And we saw that on the earlier poll slides. And just the phrase, it's as though they don't exist, it's really just a profound way to think about the way people of color are treated in the system where, we're entrusted to support people in their mental health and substance use recovery journeys. The next quote, Black peers talk about how they are afraid of police and are treated poorly by the police, and the white peers say, you are delusional. That is not true. Y'all are making that up. The persistent unwillingness to accept another person's life experience because it does not align with our own is something that, pervaded a lot of media discussions throughout the social unrest this spring and summer, and quite frankly, in some of my own family. I am from Georgia. I have a very large and very white family, and I love them, but there are some whose worldview and experience with law enforcement, just does not allow them, at this point in time, to be willing to accept that Black people are treated differently or unjustly by police. They worship and golf and tailgate with law enforcement, and some of them are, their neighbors, and so again, going back to the idea I mentioned at the introduction of this webinar, that community-based services reflect the communities they serve, it's important to recognize that mutual support groups are a big part of many recovery and wellness programs. And, without being believed, without mutuality, it's hard to see how a mutual support group works. Like, how does that work? The next quote, hold on, where were we? Okay, I was working at the hospital when a Hispanic woman was brought in by emergency. The emergency staff said, you don't even belong here. Then staff were cussing and saying terrible things to her without asking if she spoke English. Came to realize she did speak English, and it broke my heart that she had understood the names they were calling her. They were also poking at her head. It makes me sick even now to talk about this incident. This is one of the singular remarks that we wanted to include for a couple of reasons. One, it speaks directly to the experience of people who do not appear to speak English. And there weren't a lot of those, possibly because we did not ask for them specifically. The second is, it speaks to how caregivers can behave when they believe there will be no repercussions, that there is no one watching. And importantly, the woman did not get up and leave. She did not stop them from calling her names or poking her, right? Whether it was because she knew she really needed help or because she was so conditioned to this kind of behavior, even from people whose job it is to help her, or because she was scared or whatever it was, we will never know. But over the course of the past 6 years, since I've been doing this work, I've met a lot of administrators and leaders of behavioral health systems at all levels, and I do not believe that any of them would want this happening on their watch. So the question I ask myself is, where's the disconnect? How could this happen? And how could these people believe this was okay? And finally, on this question, I worked at a community service provider where peers were coming out of jail. People of color were sent back to jail at a much greater rate than whites for the same behaviors. When I asked about this, the person in charge of sending them back said that she was following the director's orders and that she needed to keep her job. She was a Black lady and said that she felt very badly every time she sent back someone. I left that job as soon as I could, and so did she. This really stuck out because it resonates so clearly with historical precedents here in the South that we don't need to get into here deeply, but where the oppressed are compelled to become oppressors. And it's just a particularly insidious example because it shifts the blame. If a pattern of behavior is ever detected from outside the organization, the paperwork trail leads back to the signature of a Black person whose neutrality is unlikely to be questioned, right? The behavior is systemic, but its root cause, which is at a management level, is shielded from view and just much more challenging to correct or even document. All right. And I will pass it back to Ms. Rosalind.
Thank you, Chris. And so this question, how does your organization respond to experiences of racism? And so we got a pretty narrow range. Well, actually, we got a decent range. And so start with the first response. It says, my organization responded with an email, Black Lives Matter and Equality Matters. And I have to ask the question, was it an internal email? Did it just go to staff, or was it something that went beyond the organization? And I have to believe that it stayed within the organization, because the next part says that, but when asked by Blacks in the organization if they could change a Confederate holiday, you guys know Confederate Memorial Day, that we get a day off for that, to another holiday, management said they would have to take that up with legislators. And so, again, kind of lip service, but when it comes to making, real change that would make folks feel, that question of, do we feel equally welcome? Was employees that of an organization that celebrates Confederate Memorial Day? Probably not. The next response, our organization was afraid to put out any communication about Black Lives Matter until after the legislative session was over, because we were afraid that if some legislators associated us with Black Lives Matter, they would cut more funds to our programs. All right. And so, Chris started out when we first, did the intro into this webinar. He talked about how when the Georgia Mental Health Consumer Network put out in their pipeline and in their email, a message about Black Lives Matter that was not only internal but external, the backlash that we got, and it just is very telling. Our organization wasn't afraid of the backlash. However, the backlash is real. We received the backlash, and people unsubscribed, and opinions about us changed because we simply said that Black Lives Matter. And so this is such a topic that, folks will be like, okay, well, we believe Black Lives Matter, but we can't say anything until after our funding is secured, because it could actually have those kinds of repercussions. And so again, that just is very telling about where we are as a society, where we are as a country. The next one, when racial injustices occur, nothing is done or said. We remember the response, when we looked at the pie chart, how has your organization responded? And 20% of people said, they haven't responded at all. And so here we go, when racial injustices occur, nothing is said or done. It's just swept under the rug. I've seen so many of my coworkers promoted that don't have the qualifications that I have. Time and time again, it's very disheartening, feeling that you don't have the support of the administration. At some point, this is going to have to be dealt with. It's very demoralizing. And it's one of those things. I think back to that question, to that comment that said that organizations don't know what it feels like to be Black. They don't understand that experience. And this speaks to part of that experience, of watching folks who I believe are less qualified than me be promoted just because they because they're not Black, And so that just is another thing. And that word is very demoralizing. You know, we start to feel defeated if we want to know what it's like to be a Black person, you know, and that day-to-day experience. You know, it can be very demoralizing, and you know, we can start to feel defeated and depressed, you know, as a result. We'll look at some more responses on the next slide to this question. All right, and so here we go. Another example. I know of several instances of racism that were reported, and none of them got any further than the initial report. This has happened time after time. So most times, people have simply stopped reporting instances because we all know nothing is going to happen. People of color do not have the support of the administration. This is really sad, but it speaks to the state of affairs in this country. People seem to not want to confront the issue of racism, but you know, it feels like it's just best left untouched because it's touchy and it's sensitive, and people, you know, it brings up lots of feelings. And so, you know, this response of just ignoring it and acting like it didn't happen, you know, and think about, you know, you can't help but look at, you know, how what we're talking about within our behavioral health system and within our organization, we can't help but look at how this mirrors, you know, some of the response from the country. You know, we actually have, you know, an administration at the federal level that has put a ban on trainings around cultural humility and anything that deals with racism in the workplace. And so again, it just speaks volumes to where we are. This next one, diversity committee meets weekly. We have discussions on how to improve. If there are peers that want to link up with someone on the committee, they can set an appointment for the peer so that the peer can feel heard. At RISE, and that would be the fabulous Alexia Jones, she has a space where people can create. It was essential that they could create using those feelings and express them in safe places. They started a creative protest where they could take their creations and have their voices heard and broadcast. And Emory, who we do this work with, was again a part of, you know, this process of allowing people space, you know, to express their feelings. And interestingly enough, if you guys don't know about RISE and Alexia, she is a woman of color. And so, you know, she's able to bring her personal experience in, and she recognizes at a different level the importance of creating spaces where people can feel, you know, safe to express themselves and to really work through those feelings that come up, you know. And then this last one, it says organization responded to a vendor who displayed racism by not continuing to do business with this vendor. This is very powerful. This is what, you know, I can say I'm not a racist and we don't believe in racism, but when we practice anti-racism, it's kind of putting your money where your mouth is. And this organization, they pulled their account, you know, and that is so commendable. And this is, you know, I mean, money is you know, that's the thing that moves this country, you know, this capitalistic society. And when folks are willing to risk, you know, pulling their money away from someone to say, you know, I just cannot be a part of, you know, what you stand for. I can't be a part of racism. And by me spending money with you, that I'm supporting your racism. And so, you know, being financially responsible, and I say that in that if we know that, you know, the folks that we're doing business with are racist, then we pull our money from there and maybe even put it into a Black-owned business or a business, you know, run by people of color. This is real support. This is real allyism, if that's a word. And this is what anti-racism looks like. Thank you, Chris.
Thank you, Roz. And then we're supposed to have a half hour for questions, but we are going to eat into a little of that time. We apologize. Southeast Mental Health Technology Transfer Center. I'll go through this fast. What changes need to be made to remove racism as a barrier to recovery in your community? The responses we got back, we have to first acknowledge there's a problem. We have to be honest about the events that have happened and those that continue to happen. Economic changes need to happen for more opportunities and options. Step in when you see it and need to respond, and listening sessions, town halls, communication. Those last three, those slashes there, they're together because the need for more and better communication dominated the responses to this question. People phrased it a little differently, had different suggestions about what that communication would look like, but communication dominated. And through the work the Georgia Mental Health Consumer Network has done in listening sessions in town halls around the state, we know that getting stakeholders and civic and policy leaders together in the same room or even on a Zoom call really can have an impact. I know it's easy to shawl communication. We've been communicating for the past, 60 years, right? And, where's it gotten us? It really does create impact. Just last week, the Georgia Mental Health Consumer Network was, met with the management of Ponce City Market, which is a large mixed-use development here in Midtown Atlanta, and, to discuss a project they're embarking on to help find jobs for people in the neighborhood in substance use and mental health recovery with employment barriers, including involvement with the criminal justice system. And most of the potential participants in the hiring initiative will be people of color from the traditionally Black neighborhood that has been displaced by Ponce City Market and its neighbors, and that has seen a lot of gentrification over the past few years. So it's like a community project with enormous potential. And it started on a Zoom call that me and Roz were on, right? We were just like, when I said, hey, would you be willing to have a conversation? We're like, yeah, we'll talk. So, having this dialogue can create opportunities. Of course, ending cycles of economic limitation is an incredibly important factor in removing racism as a barrier to substance use and mental health recovery, because when people are able to afford quality behavioral health care and have choices, which most of us don't have in a public behavioral health system, and they have choices about their providers, and they can maybe even choose providers who look like them and can, provide real, true empathy and understand their lived experience, it changes the whole dynamic of the kind of care people receive. It just does. The stepping in when we see racism and responding to that still, in 2020, that can take courage, on both a personal level and an organizational level. This work is not easy. We stepped out, people unsubscribed. Sometimes you step out and people shut you down. That's okay. But creating equitable access to quality recovery, wellness, supports and resources, that's the foundation of the work we do at the Georgia Mental Health Consumer Network. And we know from our listening sessions that that's the work, you all want to do too. I don't know who's on the call today, but I'm assuming if you're here, and I make a lot of assumptions. I always assume positive intent. It gets me in trouble sometimes, but not on this call today. We just got to keep moving forward. I think one of the ways we can do that, an action we can take today is just by identifying ourselves, as allies or potential allies to, the Black and brown people in our lives. It might be an awkward conversation. I have so many awkward conversations, but they don't necessarily get any easier. But when I see the rewards that come from them, it makes them worthwhile in the end, right? It's sort of like asking somebody out on a first date, right? It never gets easier. But when you have a nice date, it gets you back out there. But one of the ways we can keep moving forward, beyond putting ourselves out there, is by having conversations. And the Georgia Mental Health Consumer Network, and I promise Emily and Stephanie this is going to be real quick. Georgia Mental Health Consumer Network has adapted Dr. Moore's 21-day racial equity habit building challenge. We are really excited about You know, Dr. Moore says change is hard. Creating effective social justice habits, particularly those dealing with issues of power, privilege, supremacy, and leadership, is like any lifestyle change. You know, like losing weight, which I've been doing for, I don't know, past 35 years. Setting our intentions and adjusting what we spend our time doing is essential. It's all about building new habits. Sometimes the hardest part is just getting started. We have created a link on our website, and starting this Saturday, October 25th, we are going to be doing this 21-day challenge together in a private, closed Facebook group. We have put together a list of what we think are thoughtful, some are fun, some are sad, but just engaging opportunities to, you know, think about where our worldview comes from, where our feelings, attitudes about race, how those are formed and how those can be reformed, right? How we can, and importantly, moving forward, learning to think critically about what it is we're seeing. Where did it come from? Who made it? Why did they make it? You know, is this true? Does this reflect my experience, or is someone trying to change something about me? You know, what we think is a really good opportunity for us to engage with you all and with each other. Me and Roz are really looking forward to it. We came up with the playlist, if you will, and we're going to be, you know, on Facebook in the group. If you would like to join the group, you can just email 21days@gmhcn.org and email us the email address you used to log into Facebook. I know for a lot of you that may not be the email you will use to, because I log into Facebook with an email I don't have access to anymore. And some of you may be the same way. So we hope you will join us there. We are going to have like 4 more topical discussions, webinars coming out of this material that we've been reviewing with you today. And, you know, hopefully through this 21 days conversation, some more ideas and content will come up as well. But right now, we are going to go to questions. Do any of you have any questions? Emily, did any questions come up during the webinar? I did not have my chat open.
Yeah, so we can go ahead and start with one of the questions that came through in the chat. And while we're reviewing this first one, everyone who's still in attendance, please feel free to put your questions in the Q&A section. But we did have one from the chat box, which was just asking, from the data that we reviewed from the listening session, did we have any information on the race of the respondents to those
We did not.
questions?
We did not collect any demographic data on the people participating, no.
Gotcha.
It's hard enough just getting people to respond to a poll question. I can't imagine trying to get folks to respond with demographic data. It would be great, I agree, but not that you said it would be great. I think it would be great, and we would love to do that in the future, but in the Zoom format, it might get very complicated.
Gotcha. Okay. And then there was another question that was entered in during the presentation in the Q&A that said, how many people actually participated in the surveys so that they can compare these percentages to a real number?
Okay, so in the poll questions, we had between 43 and 46 people who responded to each poll question. Don't know why, maybe time ran out, and don't know why there was variation in that number. And in the breakout groups, because of the way the notes were taken, we know that there were 40+ people in the breakout groups, but we don't know how many people actually responded. So in the breakout groups, you know, where there were 4 to 6 people, one person could have provided all of the, you know, we don't know how many people provided responses in the breakout groups.
Gotcha. All right. Still reviewing some of the Q&A to see if we have any other questions. Again, everyone, we still have a little bit of time, so please feel free to enter in your questions to the Q&A section.
And also, please stick around for the GIPR survey, which is really important because we want to be able to keep doing this work.
Thanks, Chris. We do have one question about where we will be sharing the slides. So yes, we will be sharing these slides. We actually are recording this entire webinar. So both the recording and the slide deck will be on the Southeast MHTTC website. And those are usually available in about 72 hours. We do have another question. This is very specific. Do you all come to organizations to present the Racism and Recovery presentation?
We definitely are willing to present this information where we are invited. At this point, I don't know that Rosalind or I are traveling anywhere, but we can zoom to anywhere. So if you're interested in having us share information with your organization, just please email either of us, Rosalind@gmhcn.org or Chris@gmhcn.org, and we'll be happy to see what we can do.
And there is kind of in the same vein as that last question, will this be an ongoing continuing education on racism? And I was hoping Chris and Roz and Sherry, you could talk a little bit more in depth about the upcoming dialogues that we're planning to have on this topic to dive a little bit more in depth.
Sherry, do you happen to have your list in front of you?
I regret I do not, but it is something that we could share with folks for sure. We will be having, I believe it's 5 more discussions from now through February, and we're going to talk about different topics related to race and behavioral health care and peer services and general medical care and other related topics for all of you all who would like to participate. We're looking forward to it and excited about the opportunity.
Thanks, Sherry. One other question. Can you all, and this is in relation, I assume, to the listening session data that was shared at the beginning, can you give any other demographic information, geographic? Were all of the respondents peer support specialists?
The vast majority, Roz, do you want to take it?
You know, I was going to just say the vast majority of folks who participated were certified peer specialists, and they came from across the state of Georgia, and that really is the extent. We did have a few people who are, who are outside of the state, but the majority of folks were, folks from across the state of Georgia and certified peer specialists. And we didn't gather, any other demographic information as far as race or sex, gender or anything like that. We were just really interested in having the organic conversation. Go ahead, Chris.
Yeah, no, I was going to say Florida was represented, South Carolina was represented, Alabama was represented, and Arizona. Wasn't there someone from like Arizona or New Mexico?
Yeah,
really.
Yeah.
New Mexico,
Yeah.
Kentucky, Texas, yeah.
DC also. Somebody just said DC was in the house. So thank you.
All right. Next question. What is a way to sustain the attention and action that are needed to address this issue of racism?
I mean, honestly, for one of the reasons we're really excited about, the 21-day challenge, and, we would encourage any organization, like, personal disclosure here, my church actually did it. Like I attend church, my church adapted this Dr. Eddie Moore's 21-day challenge, because what it does is it gives you the opportunity to engage with race and racism each day, without it necessarily being thinking about horrific things that have happened or responding in real time to things that are on the news, right? It gives you a way to think critically and to think about ways of, meaningfully moving forward with intention instead of just outrage, right? I mean, not that there's not reason to be outraged about stuff, but it's having a deliberate plan that you can engage with other people in a way. And we hope ours will be fun. I mean, we're going to be watching Beyonce videos, and Chris Rock. We're going to have fun, but we're also going to just keep that focus and like not letting this go away. So
Yeah, go ahead, Sherry.
I was just going to say, having the courage to have conversations about it and talking to each other and trying to create safe spaces where people can, authentically engage about this. And one of the things that the Georgia Mental Health Consumer Network is doing, because of course, we're just like everybody else. We get some things right and we don't get some things right. And so we're having a meeting with all of our staff on Friday that we have entitled a race in the workplace inventory, and we're bringing our staff together from all over the state in a Zoom meeting to start this conversation. We're distributing questions for people to think about, to try to set the the engagement, and hopefully it'll be the beginning of figuring out where we are, and maybe if we can figure out where we are, we can figure out where we need to go. So certainly talking with each other with authenticity, as scary and hard as that is something that we're doing.
Yeah, and I would just follow that up with anyone again who has the courage, has the connection. Talk to your executive director, talk to your management team, and share some of this information that you've been given today, because I think that again, our numbers, are the data that came in kind of reflective of where we are as a country, as within our larger society. And we know that communication, when the question was asked, how can things change, it starts with a conversation, as Sherry just said. And so ask your management to create space once a week, once a month, whatever it is, for folks who want to participate in these types of conversations. Bring people of color to the table, and create again these spaces for safe sharing, because James Baldwin, he said, not everything that is faced can be changed, but nothing can be changed until it's faced. And so we have to face it and work at it.
All right, thank you all so much. Sorry about that. I'm going through and answering some of the other Q&As about the logistics of the webinar. Our next question was, what other resources are there for a white person to help them understand and better treat people of color?
There are a ton of them. I think the most important thing is to understand there's not one resource You know, there are a lot of resources. And also it's, you know, a topic that changes over time. You know, the best practices 10 years ago were not the best practices today. You know, like on our 21-day challenge, we show a video from a Broadway show called Avenue Q. That's called Everyone's a Little Bit Racist. And 10 years ago, that was like, you know, sort of cutting edge. And, you know, people thought that was just, you know, the best thing to come into like talks about racism. And today it is just cringe worthy. Roz, did it make you cringe? Right?
Yes.
So it's like, you know, just learning that, you know, understanding that it's a process. And I think if you will send us an email, we will put our heads together and try to get some good resources together for you. But I mean, it's that we're always learning about something new. I mean, you know, just earlier today, I bought a book, The New Jim Crow, which I had never heard of before, right? But like suddenly it's like, I guess I'm like one of the few people left in the world who hasn't read it. But, you know, it's this like influential seminal work. And like, okay, somehow I just missed that on my reading list, but you know, I have it now. It's coming, it's mine. And it's a few years old, but people still like refer to it, I guess, a lot.
Someone just put in the chat, White Fragility by Robin DiAngelo. It says it's a great book. And you know, it really does explore why it's so difficult to have these conversations. You know, why does this defense and these things come up? You know, when we start to have these conversations, and it can be so uncomfortable that, you know, folks just decide it's too uncomfortable to talk about. And that is the thing that allows, you know, our racist practices and things to continue. If we don't talk about it, if we act like it doesn't exist, like folks said, you know, in their responses to our questions from our listening session, you know, so White Fragility definitely, you know, along with so many others that Chris talked about, is a really good book. Thank you, Donna Morrell.
All right. For our next question, throughout the presentation, whenever a racist situation was used, it was from a white person. Do you think this overrepresentation of racism only coming from white people or white organizations could possibly increase any racial division that already exists?
Could you repeat that, please? I want to make sure I heard it right.
Yeah. Throughout the presentation, whenever a racist situation was used, it was from a white person. Do you think this overrepresentation of racism coming only from white people or white organizations could possibly increase any racial division that already exists?
Well, first I'll respond by saying that certainly wasn't intentional when we were talking about when Roz and I were dividing up the work. That certainly wasn't a thought of ours. And I definitely don't think of the Georgia Mental Health Consumer Network as a white organization.
Yeah, I don't think that's accurate, really. I mean, I don't think that's the case.
Yeah, we again, we didn't collect any kind of demographic information, and you know, as responses, folks went into breakout rooms in the listening session, and the responses were captured, and there was nothing to indicate whether this was a white person or a person of color who made whatever statement that it was. And you know, I know certainly, you know, like the response that said that management doesn't represent the rest of the staff. I mean, I agree that that's not accurate as far as the way we presented this data. I mean, we didn't collect any kind of demographic information.
Okay, thanks guys. Our next question, is there a sample agenda that an organization could use to have these conversations?
Yeah, there are actually a lot of them. I think that the really important piece is, and I don't know, Raj, you can um, help me out with this. I think more important probably than the question is the questioner, right? Having the right facilitator, the right person asking the questions is really, I mean, there are tons of lists of like how to have these conversations and the questions to ask, you know, if you just Google it, but I think more important is having the right facilitators in place.
Yeah, I agree. And you know, you can, that appreciative inquiry approach that comes from what's working well and what could be different, what keeps you hopeful, that always, you know, elicits good responses. Um, Being willing to really sit with worldview and have conversations around people have come to know what they know. And you know, the challenge with that is that it can be very uncomfortable. And so learning how to sit with discomfort and having a willingness to hold multiple truths so that, you know, the person that's talking, this is what's true for them, you know, and even if it just grates at my very soul, I still, you know, have to be able to sit long enough and to hold that energy, to sit with that discomfort, to stay engaged in the conversation, because that really is where, you know, if there's hope for change, that is a place where change can happen when we can really share and explore, you know, the ways that we've come to know what we know. We might discover that, wow, you know, I don't even know why I believe that. I just do, you know, because my mama told me this is the way the world was, or whatever. So again, being able to sit in discomfort, being able to hold multiple truths, and explore how people have come to know what they know, setting judgment aside and those things.
There was a person on with us today who is someone that I know from another state, very smart, a very person that thinks deeply, was uh, was put off because they felt that we didn't bring forward enough solutions today, and I couldn't get my chat messaging to work. It froze up on me because I wanted to ask her to stay, because she is definitely someone that could help us with you know, talking about ways that, I mean, you know, ways to have these conversations so that we can move forward and can find ultimately solutions for various challenges that certainly our organizations have anyway, you know.
All right, everybody. Well, Sherry, Roz, Chris, I hate to cut us short, but we only have about 2 minutes left to complete the evaluation. So I'm going to have to cut the question and answer time off there.
Thanks, everyone.
Thank you all.
Thank you all. Just want to let everyone know that the Southeast MHTTC thanks you for your participation in today's event. We value your feedback and invite you to evaluate our event. Please complete a brief SAMHSA required survey by visiting the link presented on your screen. Completion of this survey will provide information to SAMHSA and assist us in planning future events. Afterwards, you will automatically be redirected to additional questions from the Southeast MHTTC regarding the impact of this event on your knowledge and skills. There, you will have the opportunity to download a certificate of attendance for your records. And if you complete the survey, you will receive 1.5 contact hours. Please allow about 5 to 10 seconds for your browser to redirect you. Again, our center appreciates your participation and feedback. We hope you will join us for future events. Please visit our website to learn more. This concludes today's presentation.